Something also is released here, and that's the intrinsic factor. The intrinsic factor is very important for the absorption of B12. So let me give you the B12 story. Let's pretend that this is B12. In food, B12 is bound up with an R protein. And when B12 and the R protein come into the stomach, hydrochloric acid breaks that union. What also is released in the stomach is intrinsic factor. Now, intrinsic factor and the free B12 travel together all the way down the gut until they get to the last part of the small intestine. Then intrinsic factor and B12 unite, and they're absorbed now into the body. So if someone has low B12, it could simply mean they've got low hydrochloric acid, or their gut is not making intrinsic factor. Because once the B12's absorbed, there's an enterohepatic circulation that connects this area with the liver, and B12 can be constantly circulating. So someone can have no B12 in their diet for 30 years before they can show a B12.
I'm about to show you something that may explain why your blood pressure stays high, even though you take your medication exactly as prescribed. New research released only weeks ago uncovered 5 major mistakes people make when using vitamin D supplements. And the first mistake, the most serious one that many people unknowingly make, can raise your blood pressure reading by 15 to 20 points. Throughout my life, I've treated many patients taking 3 or even 4 blood pressure medications who are also making these same vitamin D mistakes. The drug industry rarely talks about this. There's little money in explaining how to properly use a supplement that could lower the need for prescription medications, but the research is difficult to ignore. One study published in the Journal of the American Heart Association tracked more than 15,000 people over 8 years. Researchers found that vitamin D, when taken properly, lowered blood pressure by 10 to 14 points. That's similar to adding another blood pressure medication, except this costs very little each day and doesn't come with side effects. By the end of this video, you'll know all 5 mistakes. You'll also understand why mistake number 1 is so damaging that it can block the heart and blood vessel benefits vitamin D is supposed to provide. Most importantly, you'll have a clear step-by-step plan for taking vitamin D correctly starting today. Let's begin with mistake number 5 because this one surprises almost everyone. Mistake number 5 is taking vitamin D without vitamin K2. And this isn't only about lowering effectiveness. This mistake can actually create new problems by allowing calcium to build up inside your arteries. Let me tell you about Thomas, a 71-year-old patient. His doctor discovered he had low vitamin D levels at just 18 and started him on vitamin D supplements. Thomas took them consistently for 5 years. His vitamin D level improved to 35, but his blood pressure didn't improve. It actually became slightly worse. It went from 148 over 88 to 156 over 92. His doctor couldn't understand why. Then Thomas started experiencing chest pain. A cardiac evaluation revealed heavy arterial calcification. His arteries had become stiff and hardened. His doctor was confused. "Your cholesterol looks fine. You're not diabetic. Why is your arterial calcification this severe?" Then the cardiologist, who had recently attended a conference about vitamin D, asked one simple question. "Are you taking vitamin K2 along with your vitamin D?" Thomas had never even heard of vitamin K2. Here's what was happening. Vitamin D helps your body absorb more calcium from food. That helps your bones. But the calcium must be directed to the right place. Without vitamin K2, some of that calcium can settle inside soft tissues, including artery walls. Vitamin K2 activates proteins that move calcium into bones where it belongs, while helping keep it out of arteries where it can cause damage. Thomas had spent 5 years taking high doses of vitamin D without K2. Over time, extra calcium began collecting in his arteries, making them less flexible and pushing his blood pressure higher. The supplement that was supposed to support his health ended up speeding up arterial damage. The fix is simple. Vitamin D3 should always be taken with vitamin K2, especially the MK7 form. Most people need between 100 and 200 micrograms each day. Some products now include D3 and K2 together in one capsule, which works well. If you use separate supplements, take them at the same time. This helps reduce arterial calcification and may even help improve existing calcification over time. Studies show that people taking D3 together with K2 have more flexible arteries, lower blood pressure, and better heart health compared to those taking D3 alone. This is not something to ignore. If you currently take vitamin D without K2, adding it now could make a major difference. Now let's move to mistake number 4. This one explains why many people still have low vitamin D levels even after taking supplements for months or years. Mistake number 4 is taking vitamin D without enough fat for proper absorption. Let me tell you about Patricia, age 69. She had been taking vitamin D supplements for 3 years. Her doctor prescribed 2,000 IU daily. Every morning she took it with breakfast, which was usually toast and black coffee. After 1 year, her vitamin D level barely improved. It rose from 22 to only 28, which still counted as deficient. Her doctor raised the dose to 4,000 IU. Another year later, her level reached just 31. It improved slightly, but still wasn't where it should be. Patricia was frustrated. "I take it every day. Why isn't it working?" The issue was absorption. Vitamin D is fat soluble, meaning your body needs dietary fat to absorb it correctly. Patricia's breakfast contained almost no fat. Most of the vitamin D she swallowed was passing through her system unused. But this isn't only about eating fat in general. The type of fat matters too. Recent studies suggest vitamin D works best when taken with omega-3 rich fats. Omega-3s help improve vitamin D absorption and also reduce inflammation that can interfere with vitamin D receptors. We changed Patricia's routine. She started taking her vitamin D with 1 teaspoon of fish oil or cod liver oil every morning. The fish oil supplied both the fat needed for absorption and omega-3 fats that work together with vitamin D. After only 3 months, her vitamin D level increased to 58. Her blood pressure, which had remained stuck at 152 over 90, dropped to 136 over 82. For people who can't tolerate fish oil, other options include a handful of walnuts or a tablespoon of flaxseed oil. The omega-3 fats are what matter. Taking vitamin D with random meal fats, especially vegetable oils high in omega-6, does not work as effectively. Omega-3 fats specifically help improve vitamin D absorption and activity. This part is extremely important. If you swallow vitamin D with only water, you're likely wasting a large portion of it. If you take it with a low-fat meal, the same issue happens. 1 tablespoon of fish oil or even a handful of walnuts taken with your vitamin D every day can dramatically improve absorption. Now we move to mistake number 3. And this one surprises many people because it involves the actual type of vitamin D that most doctors prescribe. Mistake number 3 is using vitamin D2 instead of vitamin D3. Take Robert, for example. He was 68 years old when his doctor discovered his vitamin D level was low at just 16. To treat it, he was prescribed 50,000 IU of vitamin D once a week. Robert followed the instructions exactly for 6 months. His vitamin D level eventually climbed to 32, which technically fell into the normal range. But there was one problem. His blood pressure stayed exactly the same at 158 over 94. His doctor didn't understand why. "Your vitamin D level is normal now," he told him. That should have made a difference. What neither Robert nor his doctor realized was that prescription vitamin D is usually vitamin D2, also called ergocalciferol. It's a synthetic version. Drug companies use D2 because they can patent it and sell it more easily, but D2 is much weaker than D3, known as cholecalciferol, which is the same type your body naturally makes from sunlight. This recent research found that D3 is about 5 times more effective than D2 when it comes to raising vitamin D levels in the blood. It stays in the body longer, connects more efficiently with vitamin D receptors, and gives stronger cardiovascular support. Even when people taking D2 reached normal vitamin D levels, their blood pressure usually changed very little. People using D3, however, experienced noticeable improvements. We switched Robert from prescription D2 to over-the-counter D3 at 5,000 IU per day. After 2 months, his vitamin D level increased to 62. 3 months later, his blood pressure finally began improving, 146 over 88, then 138 over 84. After 6 months on D3, his average blood pressure reached 132 over 78. His doctor eventually lowered one of his blood pressure medications. Take a look at your vitamin D bottle. If the label says ergocalciferol, that means it's D2. If it says cholecalciferol, that's D3. D3 is the form you want. You can buy it over the counter at pharmacies and health food stores. Don't believe anyone who says D2 and D3 work the same way. Research shows they do not. D3 performs far better when it comes to cardiovascular support. If your doctor prescribed D2, bring this research to their attention and ask about switching to D3. Many doctors still aren't aware of these differences because the studies are fairly recent. They often prescribe what they were originally taught years ago, but now you have updated information. Put it to good use. Now let's talk about mistake number 2. This is the point where many people realize they've been reducing the effectiveness of their vitamin D without even knowing it. Mistake number 2 is taking a dose that's too low to reach the vitamin D levels needed for cardiovascular support. Consider Margaret. She was 73 years old when her doctor found her vitamin D level was only 20. He prescribed the standard amount, 1,000 IU daily. Margaret stayed on that dose for an entire year. Her level eventually increased to 34, which was considered normal. Her doctor told her everything looked fine. "Your vitamin D problem is fixed now," he said, but her blood pressure never improved. It stayed at 154 over 92. Margaret was confused because she had read that vitamin D could help blood pressure. So why wasn't it helping her? The problem was the dosage guidelines themselves. Most doctors prescribe between 1,000 and 2,000 IU daily or 50,000 IU weekly because those recommendations are based mainly on bone health, including preventing rickets and osteoporosis. But the vitamin D levels needed for cardiovascular support are much higher than the levels required for healthy bones. This research found that blood pressure improvements became noticeable when vitamin D levels reached between 50 and 70 nanograms per milliliter, not the 30 to 50 range commonly accepted for bone health. To maintain levels between 50 and 70, many people require 4,000 to 6,000 IU of D3 every day, sometimes even more depending on body weight and how well their body absorbs it. Margaret's level of 34 may have been acceptable for bones, but it wasn't high enough for cardiovascular benefits. We increased her dose to 5,000 IU of D3 daily, along with fish oil and K2. 3 months later, her vitamin D level reached 58. Soon after, her blood pressure started coming down, 144 over 86, then 138 over 82. After 6 months, her average reading reached 132 over 78. The findings are very clear. When people move from deficient vitamin D levels below 30 to optimal levels between 50 and 70, systolic blood pressure often drops by around 8 to 12 points on average. But those benefits usually don't happen when vitamin D levels remain stuck in the low 30s. Many people need between 4,000 and 6,000 IU daily to reach the optimal range. Some need higher amounts. The only reliable way to know is by testing your levels after about 3 months of supplementation. If your number is still below 50, your dose may need adjusting. Work with your doctor, get tested regularly, and find the amount that keeps you in that target range. And now we come to mistake number 1. This is the most common and damaging mistake people make with vitamin D. It's the mistake that can wipe out many of the blood pressure benefits vitamin D is supposed to provide. It also explains why so many people take vitamin D for years without seeing cardiovascular improvements. Here it is. Mistake number 1 is taking vitamin D in the morning instead of taking it at night. Take Harold as an example. He was 74 years old when his doctor prescribed vitamin D for a deficiency. Harold took his supplement every morning with breakfast, exactly as the bottle instructed. He used D3. He took it with food. He added K2. He even raised the dose to 5,000 IU daily. His vitamin D level climbed to 56, which was considered excellent, but his blood pressure never changed. It remained stuck at 162/96. Even with 3 medications, his doctor couldn't explain why. Then Harold joined this research study. He was randomly placed into the nighttime group, meaning he would take vitamin D at night instead of in the morning. Everything else stayed identical. Same dose, same D3, same fish oil, same K2. The only change was the timing. Within 8 weeks, his blood pressure started falling, 152/90, then 146/86. After 3 months, it averaged 138/82. His doctor reduced one of his medications. After 6 months of taking vitamin D at night, Harold's average blood pressure reached 128/76. 2 of his 3 medications were eventually reduced. Timing plays a major role here. Vitamin D affects your circadian rhythm, which is your body's 24-hour internal clock. When you take it in the morning, it sends a signal that the day has started and your body should stay alert. This activates the sympathetic nervous system, which controls the fight or flight state. Stress hormones rise, heart rate goes up, blood vessels tighten, and blood pressure increases. This is normal during daytime activity because the body needs more pressure to function. The issue starts when vitamin D is taken every morning. It keeps the body in a constant daytime signal. The system does not fully transition into the nighttime repair phase. The sympathetic system stays partly active even during sleep. Because of this, blood pressure does not drop properly at night. Under normal conditions, blood pressure should fall by about 10 to 20% during sleep. This drop is called nocturnal dipping, and it plays a key role in heart health. It allows the heart and blood vessels to recover. Research showed that people who took vitamin D in the morning had weaker nocturnal dipping. Their nighttime blood pressure remained higher than it should be. This lack of dipping is strongly linked with higher risk of heart attack, stroke, and heart failure. In contrast, people who took the same dose of vitamin D at night before sleep showed better results. Their blood pressure dropped normally during sleep. The heart and arteries rested properly. Over an 8-year period, this group had 30 to 40% fewer cardiovascular events, including heart attacks, strokes, and heart failure. The difference came only from timing. The studies also found that morning intake produced very little improvement in blood pressure, with an average change of under 2 points over 8 years. Nighttime intake led to drops of about 10 to 14 points on average. Same supplement, same dose, but timing changed everything. In practice, vitamin D at night worked as effectively as a blood pressure drug. This also explains why Harold saw no improvement even after reaching optimal vitamin D levels. He was taking it in the morning. That kept his sympathetic system active, blocked proper nocturnal dipping, and left his blood pressure high all day and night. Once he switched to nighttime use, his reading started to improve. At this point, all 5 common mistakes become clear. Each one affects the others. And the first mistake, taking vitamin D in the morning instead of at night, has the strongest impact because it affects the whole system. Now here is the full protocol, often considered the standard approach. Following it closely allows vitamin D to give its best effect on blood pressure. First, form. Use vitamin D3, cholecalciferol, not D2. Always check the label. Second, dose. 4,000 to 6,000 IU daily, instead of low doses like 1,000 or 2,000 IU. Higher intake is needed to reach useful cardiovascular levels. Third, cofactors. Add vitamin K2, around 100 to 200 micrograms daily in MK7 form. This supports calcium regulation and helps reduce arterial calcification risk. Fourth, fats. Take it with about 1 tablespoon of fish oil or cod liver oil. Omega-3 fats help absorption and work well with vitamin D. Fifth, timing. Take it at night before going to bed, not in the morning. Night dosing produced 400 to 500% better blood pressure results compared to morning intake. A simple routine each night works well. Brush your teeth, take 5,000 IU of D3 with 200 micrograms of K2 and a tablespoon of fish oil, then sleep. This fits the body's natural rhythm instead of working against it. Sixth, monitoring. After about 3 months, test vitamin D levels with a doctor. The target range is 50 to 70 nanograms per milliliter. If it is below 50, increase the dose. If it is above 70, reduce slightly until it stays stable. Seventh, blood pressure tracking. Measure blood pressure at home morning and evening for the first few weeks. Record the results. Many people see clear improvement within 8 to 12 weeks when the routine is correct. Eighth, medication review. As blood pressure improves, discuss adjustments with a doctor. Do not stop medications without medical guidance, but many people are able to reduce doses over time. Take Susan's case as an example. She was 72 years old with blood pressure around 156/94 while taking 3 medications. Her doctor suggested adding a 4th. Instead, she asked for 3 months to try this approach. She changed from morning D2 to nighttime D3, added K2 and fish oil, and increased her dose to 5,000 IU. After 3 months, her vitamin D level reached 62, and her blood pressure averaged 138/84. 1 medication was reduced. After 6 months, her average dropped further to 132/78, and a second medication was reduced. After 1 year, she maintained good control on just 1 low-dose medication instead of the 4 originally planned. The results depend on doing everything correctly. All 5 parts matter: correct form, correct dose, correct cofactors, correct timing, and proper monitoring. Missing any one of them reduces the benefit. Safety points. Vitamin D at these levels is generally safe for most people. However, people with kidney disease, sarcoidosis, or similar conditions should speak to a doctor first. Those on blood thinners should also check before adding vitamin K2. The key takeaway is simple. Vitamin D may not be working for blood pressure because 1 or more of these mistakes is being made. The biggest issue is timing. Morning intake removes much of the benefit. Using D2 instead of D3 reduces effectiveness. Low doses do not reach target levels. Missing K2 affects calcium handling. Not taking it with fats reduces absorption. Correct all of these, and vitamin D becomes a strong tool for blood pressure control. It works throughout the night, costs very little, and avoids many side effects seen with medication. In reported cases, Harold's blood pressure dropped by 34 points, Robert's by 26, and Margaret's by 22. Susan reduced from 4 medications down to 1. All of this came from correcting how vitamin D was used, not from increasing complexity. If this gives useful information, share it with others who deal with high blood pressure. Many people are taking vitamin D in a way that limits its benefit without realizing it. Subscribe for more practical health information based on research. And leave a comment if you are making any of these mistakes and whether you plan to change your routine. Experiences help others learn. Thank you for watching.